The survey, going back to the survey that I recently did about millennials, how many positive words versus how many negative words do you think you're going to see here? Spoiled and entitled was the number one. Spoiled and entitled. Tech savvy, that's a good one. That's a positive one. Wants instant gratification. I see a lot of nodding. And inventive free thinker. So we've got 2 positives and 2 negatives. But of all the generations that we asked about, this is the one that got 2 negatives and 2 positives. This is the one that got 2 negatives and 2 positives. With the baby boomers, we got 1 negative and 3 positives. With the Gen X, no one knew what to say about them because no one cares about Generation X, unfortunately. But these are the words that people used. Half of them, 50% of the terms that came up over and over and over again were very negative. And I did hear a couple folks smiling, or sorry, saw you smiling and heard a couple people laughing. So I'm wondering if this resonates with some people here, that you feel that way also. So brings me to my question is, are you ageist? We tend to look at ageism and age discrimination as against older people. Can't it be against younger people? It's a huge problem in the workplace, and it's a huge problem in health and mental health care. What are the problems? I'm not saying that anyone has to say that they feel ageist sometimes toward millennials, but when you look at surveys and you look at the data, people feel really comfortable saying things like, oh, they're spoiled and entitled, where they wouldn't think of using a racial slur. They wouldn't think of saying something derogatory about another person's religion. They wouldn't think about saying something negative about where someone emigrated from because of sensitivity. But people feel very comfortable, not all people, but many people feel very comfortable poking fun at millennials and saying they're lazy, they're spoiled, they're entitled, they expect to get everything for nothing, they want instant gratification. Where can this lead to problems in your healthcare or mental health environment? Staff turnover. Because millennials are the biggest part of our workforce right now, if you as a manager or a boss have the attitude that they're lazy, they're entitled, they're spoiled, they want to do whatever they want, you're going to have a hard time retaining them. Now, listen, there are millennials and Gen Xers and baby boomers and even traditionalists that have negative qualities. Of course there are. But the data suggests that millennials are actually quite hardworking under the right circumstances. And there are more of them in the workplace than anybody else. Don't we need to consider how we need to adapt? Now, I'm not saying that maybe you own a home care company. If you have to hire home care aides, no, they cannot work from home. They need to go to the client's home. If you're hiring physical therapists for your rehab department, yeah, no, they can't work from home. We know that. But what adaptations can you make? Because we all know the happier that your employees are, the more comfortable that they are, the more secure that they feel, more often that's going to translate to better outcomes for your patients and your clients. In the care plan meeting, she's the daughter of, say, a 70-year-old, and you think, oh, God, this woman, she just wants everything right away. She has to have everything her way. She's spoiled. She wants us to work around her work schedule. Are we being a little bit ageist sometimes? Just something to ask a question and to consider, because we can dig in our heels and we can say, all right, millennials are spoiled, they're entitled, they want everything instant gratification. We can think that all we want. You can say it, but you're just going to alienate the hugest part of the workforce. And you're going to alienate customers, patients, clients, family members. So you want to think about, if you do have any of that attitude that's pervasive in your organization or in your department, or maybe just internal bias. We all have bias. If you're a human being, you've got some bias. But how do you try to become more tolerant? Because it is about becoming tolerant, understanding them, working with them, a little bit less judgmental. Now, there are millennials that maybe have narcissistic personality disorder, which is a whole other seminar. But let's talk about, okay, this caregiver is a narcissist. How do we handle those behaviors? Let's not make it about her age.